Now, with a report on the dangers of diabetes, here's our reporter, Laura Windsor.
Diabetes has become an epidemic for adults and increasingly for children, with many people unaware that they have the disease. According to registered nurse, noticeable hearing or speech delay, we spoke to speech pathologist Maureen Hallkatz of St. Jude Medical Center in Fullerton.
The epidemic of diabetes has everyone just stunned, and that's why there's international symposiums. The American Diabetes Association holds congresses every year. And it's happening in younger and younger people, and it's mainly due to our lifestyle. We are a nation of so much, and one of those things that we have so much of is fast food. We also have a lot of computers. Kids are growing up now sitting at the computer and playing their exercise games on computer with their thumbs rather than running around outside with their legs. And so with our lifestyle changes comes things like diabetes that just have to occur naturally because we're an overweight culture. Diabetes sometimes is considered the silent killer along with hypertension because people don't always feel sick. The diagnosis of diabetes is done by a very simple blood test. It can be done through the laboratory. A lot of people find out they have type 2 diabetes by going to a health fair and someone does their blood sugar stick in their finger and it's just astronomical, and so then they're recommended to go to a physician to get diagnosed. Currently, we're using the standard of any blood sugar greater than 126, 2 times in a row fasting. Also, any random blood sugar, and that means any time during the day, whether the person has eaten or not, of greater than 200. Unchecked diabetes is one of the curses of this disease. Because as I mentioned, you don't always feel sick. Your blood sugars are running in the high hundreds or the low 200s, maybe even high 200s. You may not feel very sick. However, we know that damage is occurring in the body. We know that 7 to 10 years prior to a diagnosis of type 2 diabetes, there are already microvascular changes. And that would mean changes in the eyes, the heart, the kidneys. The person with diabetes does not have to restrict themselves. There's nothing that I would say would be a poison to their body, but there's a trick. And that trick is that they have to count and measure. They have to count their portions and they have to measure their servings. People feel much better when they're taking care of their body, and part of that is having a good diet. The person with prediabetes, the person whose blood sugars are not quite over the brink, shall we say, or diagnosable for diabetes, but they're also not normal. 101 to 125, they fit in there. And the doctor says you have prediabetes, old word, borderline. The person doesn't make any lifestyle changes because they say, oh, I don't have diabetes. The doctor said I wasn't there yet. That's when they need to make their changes. You don't want to get there. If your blood sugars are not normal, there are already changes occurring in your body that you don't feel right now, but they're happening. And people just, they don't believe that. But you get told that and you still don't make any lifestyle changes, you are, within 6 months to a year, you will have overt type 2 diabetes.
Research is continuing to try to find better management options and prevention of diabetes. For the American Health Journal, I'm Laura Windsor.